Everyone, and thanks for joining us here tonight on the Choices YouTube channel. I'm Darcy Furness, the nutrition consultant here in our South Surrey location. And for those of you not familiar with our offerings, we do provide free nutrition services. So if this is something that interests you, please reach out to your local Choices markets and you can connect with a nutritionist in that store and she can fill you in with the details of how to reach her. And a great way to stay in touch for all things healthy is to go to our website at www.choicesmarkets.com and sign up to receive our newsletters and flyers. And that way they'll be delivered directly to your email in basket. And you can also follow us on Facebook and Instagram. So a couple of housekeeping details tonight. This is what we call a nutrition coupon or a nut buck, and we're going to send you one of those as a way to say thank you for your participation. It's a $10 off a $50 purchase coupon, and to get that, we're going to be sending you a short survey link tonight about 8:30, and we're going to ask you to give us some comments on the seminar and provide us with your full mailing address, and then we're going to be mailing you that coupon. And for the seminar tonight, we welcome your questions. So to do that, you need to have signed into your own YouTube account, and then you can enter them into the chat. No worries if you don't have chat. You can send questions directly to Dr. Wong through her staff at info@theiv.ca, and I'll be entering that email address for you into the chat so you'll have that to look at. And because we're on our YouTube channel, you can come back and reference this seminar again anytime you want to, which is a real benefit. Tonight, I'm delighted to introduce Dr. Kay Wong. Dr. Wong is a naturopathic doctor who is passionate about helping her patients feel and look their best from the inside out. With a background in nutritional sciences, Dr. Kay finds that nutrition, when included with a treatment, can result in vast improvements for her patients. She offers specialized testing, including food sensitivity and hormone testing, and combines these treatments such as IV vitamin and nutrient therapy, herbal medicine, and acupuncture. She also offers aesthetic procedures, including Botox, dermal fillers, microneedling, and PRF. And tonight, Dr. Wong is going to talk to us specifically about our skin and stress. And I know this is a topic that is on many of our minds, so we're really looking forward to seeing what she has to share with us. So without any further ado, let's go over to Dr. Wong. I'm going to be muting myself, and they won't be looking at me now. And let's hear what Dr. Wong has to say. So thank you very much.
Hi everyone. We're just pulling up our slides here. See your slides okay?
There we go. Perfect.
All right. Hi everyone. Thank you so much for joining us today. I'm really looking forward to sharing the next hour with you. And today we're going to talk all about our skin and the impact that stress can have on your skin. So your skin is commonly perceived as what you look when you see when you look in the mirror. But the reality is your skin covers your entire body, including your scalp, and impacts things such as hair loss, eczema, acne, and more. And all of which we're going to talk about throughout the next hour together. And it's undeniable that healthy glowing skin and hair is a reflection of a healthy body. But when we battle with factors like stress, like how 2020 has been for a lot of us, it can really show up on our skin. And today we're going to dive deep into how our stress from 2020 may have shown up on our skin and the ways that we can get our healthy glowing skin back in 2021. Ooh. Sorry, slides have disappeared. Go back there. Oh, there we go. Great, we're back. So in tonight's presentation, we'll discuss the top 10 skin conditions for both men and women that I see in my practice. These skin conditions can take an emotional toll on us, and it can really affect our self-esteem and our confidence. These skin issues are commonly caused or exacerbated by stress. And ironically, when we look at the mirror and see our stressed out skin, it can be a big stressor itself. Throughout this presentation, make sure you keep a pen handy because for each condition, I'm going to share with you some tips that you can start on right away. And regardless of which condition you might be experiencing, the goal of this presentation is to leave you empowered to get your confidence back. So before we talk about the actual skin conditions, let's talk about what exactly stress is and how it can impact us. We all might have a different idea of what stress is and how it looks like. If we put it simply, stress is the feeling of emotional strain and pressure. It's feeling overwhelmed. The medical definition of stress is that it's your body's reaction to a threat or a challenge. It's the cascade of chemical changes that occur in your body so that you can adapt to the situation. And in the case of the topic of skin health, this chemical reaction of stress can trigger skin issues or it can worsen them. And when we think about stress, we immediately think about all the negative things that are happening around us. But there are both good stress and there's bad stress. So good stress are those short-term exciting moments. Good stress can be going on that first date. Think about all the butterflies and that excitement. Or maybe you find out that your partner is pregnant. Think about how happy that moment was. Or maybe you got a job promotion or a new job. Even though these moments can be stressful, it's the type of stress that is good stress. These are those big moments in life that are meant for celebration. And these brief moments of stress have been shown to boost our immune system and increase our memory and our brain function. On the opposite end, bad stress is when you're chronically under long-term stress. Bad stress can look like taking care of an elderly parent, grieving the death of a loved one, or not being able to travel to see your loved one, like many of us have been faced with over this past year. And these stressors can take a big toll on us emotionally and physically, and it can be the trigger for our skin struggles. And unfortunately, in 2020, our bad stress has far outweighed out our good stress, which I'm sure is why many of us have joined this talk today. And this pandemic that we're going through and we continue to struggle with has caused this cascade of effects in our lives that we could have never imagined. As a result, divorce rates went up exponentially in 2020. So many people have lost their jobs, or they might be afraid of losing their jobs. And it's a lot of pressure and it's a lot of uncertainty. We are more distant from our loved ones than ever before. And with more than a year that's gone by, it's a really long time not to see our friends and family. And I actually have a baby niece that I haven't been able to properly hold yet since she's been born. So these changes, they can cause a lot of grief and a lot of pain. And some say that they've reached a pandemic wall where you start to feel numb from all that continuous stress that you have going on. And when we experience enough of these negative stresses for a prolonged amount of time, we consider this to be chronic stress. And being chronically stressed can lead us to poor lifestyle choices. These could include poor eating habits, not drinking enough water, which can be so hard if we're wearing our mask all day long. Or maybe for you, it's staying up late and you're scrolling through your phone because you don't have enough time throughout the day to unwind. So you make up for that lost relaxation time this way. And these habits can lead us to feeling worse, and then they prompt us to crave these unhealthy habits even more. And this leads us to be getting caught up in these vicious cycles of stress, of not taking care of ourselves, and then feeling even worse. So now that we've covered stress, how exactly does stress work? Well, stress is regulated largely by our nervous system. And in this picture that you can see, the yellow is our nervous system, and it runs through our entire body. And this is a woman's body, but the nervous system is the same for man or woman. And it functions in two different states. It's rest and relaxation, or the other will be fight or flight. So our first state is rest and relaxation. This is the state that we function best in. We're relaxed, our bodies are functioning smoothly. And the best example would be to think about the last time you were on a relaxing holiday. And probably that was in 2019. That's actually when I went on my last holiday. And when we were at the beach, you're sipping a cold drink, you're reading a really good book, you're listening to the sounds of the waves. These are the times where our body is in the highest state of healing, and our skin is the priority here. The other state is meant for when we're experiencing high levels of stress. So let's take ourselves back to March 2020. March 18th, 2020, that was the day that Canada was officially declared in a state of emergency. If you think back to how you felt that day, this state is what most of us would call fight or flight. And it's the state of high stress, where your body is focused on the need to fight off danger or run away, and your skin isn't the priority here. And when you're chronically in this state, this is when skin problems start to emerge. And this lack of prioritization when it comes to your skin can impact it on a cellular level, from its ability to retain moisture to even impacting the strength or the thickness of your skin. So when it comes to stress, one of the main players on how the body deals with stress is through a hormone called cortisol. So naturally, your cortisol levels will rise in the morning, and then it will gradually go down at nighttime, just like this graph here. And when this natural curve is not maintained due to stress, this is when we start to get issues with our skin. For some of us, maybe think about when you got a COVID scare, or maybe your elderly parents were diagnosed with COVID. This is an example of when cortisol levels would spike. Or maybe this whole year you've been consistently stressed about losing your job and your cortisol may now be depleted and too low. So your cortisol levels, when it's not following its natural curve, it can really greatly impact your skin. So we've talked about how, first, the state of your nervous system can impact your body, and B, how when you're undergoing stress, your skin isn't prioritized. And this becomes a problem for us because your skin is your largest organ, and it has a really big role in how your body gets rid of toxins or waste. And a way to understand this is if you imagine your body as a bucket like this, and the liquid that goes in is being your toxin or your waste. And all of these holes, they represent the way that your body eliminates or gets rid of the waste. And when we're experiencing stress, these holes get plugged up and then the bucket fills with more toxins. And if it fills too high or it spills over, that's when it starts to show up on our skin. So now that we've covered what stress is and how it can impact our skin, we'll dive into our top 10 skin conditions. And for each condition, there are multiple scenarios and plenty of information that I could provide you, but then we'll be here for days. So if there's anything that we missed, take note and I will try to answer it in one of our Q&As, which will take place at the end of the talk, or you can send us an email. I'm also going to be providing tips that you can put into action today, so make sure you keep your pen handy. So our first skin condition is acne. We are all likely to have experienced acne at some point in our lives. And while some acne can be normal, you may have noticed that your acne gets worse when you're really stressed. And having acne can be a direct stressor itself. And from personal experience and from working with my patients, I know that acne can have a really big impact on us. It can impact our confidence and our self-esteem. So what exactly is acne? Acne is when hair follicles become plugged with oil and skin cells. It becomes infected and inflamed. And there can be a lot of underlying factors for acne, but for a lot of people, there's always some sort of stress component. Stress can cause or exacerbate acne in a couple different ways. So one common way is through cortisol and blood sugar regulation. So cortisol, the stress hormone that we previously talked about, is closely related with your blood sugar regulation through a hormone called insulin. And when we think about insulin, we think about diabetes, but we all have insulin and we all need to work optimally. Insulin helps us convert our sugar over to energy. So if it's not working optimally, then we can feel really tired. And if you're chronically stressed, our cortisol levels can impact our insulin levels, which can lead to something called insulin resistance, so insulin not working well. And this can affect your skin's turnover rate and its oil production. So clogging up your pores, and then when it's mixed with bacteria, then it results in acne. Insulin can also affect your androgen levels, so your male hormones, which we as women and men both have. For women, when you may notice dark hairs on your face or random hairs on your breast or other parts of your body where you feel like a hair shouldn't be, this may mean that you have excess male hormone, which can be a big trigger for acne. This is a common picture for women that have PCOS, polycystic ovarian syndrome. And PCOS is very closely linked with acne and with stress. And PCOS actually is so much more common than we think. It can actually affect 10% of women worldwide. But the trouble with PCOS is that the diagnosis is often missed. And it can actually take an average of 3 doctors before a woman is diagnosed. And in my practice, I find that there are a lot of women that don't quite fit the picture of PCOS, but they're struggling with a lot of the symptoms. And the most common symptoms are irregular periods, acne, excess body hair, and scalp hair loss. And it may show up as abdominal weight, weight gain. It can show as fatigue or mood swings. And if you have a lot of these symptoms, it might be worth it to explore if you're within that PCOS spectrum, and if that might be the root cause of your acne. If you're struggling with acne, I have a couple quick tips for you. So the first is to change your pillowcase every single day. Our pillowcases carry a lot of bacteria and it can worsen acne. And especially if you're not washing your hair every day, which many of us aren't, and I don't, that can make your pillowcases even more dirty, and then it can transfer over onto your face. Second tip is keep your skin hydrated. Even if you have oily skin, a common mistake I often see with acne is using really harsh cleansers and too many active products. And I'm definitely guilty of using too much product myself. This can make your skin vulnerable, which is even more important nowadays with all our mask wearing because your skin is constantly being rubbed on. So if you have acne prone skin and you're wearing masks often, make sure you're hydrating your skin properly. Even if you're using a daily face cream that has hyaluronic acid in it so that your skin is properly protected. And then my third tip is to avoid sugar and dairy. Whether you're a man or woman, these are common triggers for acne. They can influence, dairy can influence your cortisol, insulin, even your male hormone levels. Hives. So this is your second skin condition. We often think of hives as this big allergic reaction, but hives can actually be caused by stress. Hives are characterized by a skin rash with raised, itchy bumps, and it can last from hours to days. Medically, hives are called urticaria, which in Latin it means to burn. And if you have had hives, or have it, you know that it can feel like your skin is burning. And I've had hives, full body hives, for 5 days in a row, from head to toe, and it was quite horrific. I was allergic to something, but I was also so stressed that I'm sure that it made things worse. Stress can actually trigger your body to release more histamine. And histamine is what makes your skin all red and itchy. And with it being allergy season, for those of you who have seasonal allergies, your stress levels may be contributing to these allergies worse. And our first reaction when we think that we're experiencing allergies or we see hives appear is to pop an antihistamine. But using antihistamines long term can actually start to make them ineffective. And there's a lot of studies to show this. So my tip for you today for hives is to use vitamin C supplementation. Vitamin C can stabilize the cells that release histamine, so it can decrease the severity of your symptoms, or it can help to prevent from a bigger allergic reaction. But very important is that the dose that you take of vitamin C is really important, and quite a high dose of vitamin C is needed for effectiveness. Eczema. Okay, so this is called atopic dermatitis, and it can be really frustrating. This can present as itchy, dry skin that can be so irritating that it affects your sleep. And for some of us, it can get so bad that your skin can crack and bleed. Stress is a really well-known trigger for eczema. Stress can cause a shift in your immune system, which decreases your skin barrier function, so that your skin breaks down and then eczema forms. And with your skin vulnerable, eczema can also be even more aggravated by environmental stressors. So for example, if you have eczema on your hands, you may notice that the constant washing and sanitizing of your hands this last year has made things a lot worse. So if you're prone to eczema, one of my tips to you is to decrease irritation to your skin wherever possible. It's surprising how many chemicals and irritants our skin comes in contact with day to day. So make sure to look at your detergents, your soaps, your clothing material. Make sure to choose cotton clothing and natural soaps and detergent with no added scents or even essential oils, which for some people can be a big irritant. And if eczema is on your hands and you're needing to wash your hands a lot, be extra diligent with a good quality hand cream. Neem cream, Nuka honey-based creams have worked really well for a lot of my patients. And if you have time, try an oatmeal mask. So blend oatmeal with water into a paste and then place over that affected area for 20 minutes or more. And oatmeal can actually buffer the pH, so the acidity of your skin surface. And it can also help for your skin to hold on to moisture better so that it's able to heal more quickly. Psoriasis. So psoriasis is a little bit less common than eczema, but it can still affect many people who are experiencing stress. Psoriasis is an autoimmune condition, which means that it's your body's immune system becomes confused and then it mistakenly attacks normal cells. Stress is a very well-known trigger for autoimmune conditions. And in psoriasis, stress can alter your skin's turnover process, with cells being replaced much more often, and that's why skin can look scaly and thick, and these are often called plaques. And with more stress, there's inflammatory signals and cause these plaques to worsen. So if you experience cycles of psoriasis, one of my tips to you is to recall if your skin gets worse in the winter and better in the summer. If it's worse in the winter, this could indicate that there's a vitamin D deficiency. Vitamin D levels are often low in autoimmune conditions, So testing for vitamin D might be a great way to pinpoint triggers for your psoriasis. My second tip is to reduce your alcohol intake. Research shows that alcohol can have a direct impact on the level of inflammation in your skin and is specifically linked with psoriasis. So if you have psoriasis and you drink alcohol, you might want to take a break from consuming alcohol so that your skin gets a chance to heal. Our fifth condition is cold sores, so we're halfway there. Cold sores are caused by the herpes simplex virus. It results in small blisters that are often present on the mouth or can affect the genitals as well. And cold sores are often not talked about because of the stigmas associated with it as a sexually transmitted infection. But it's not always sexually transmitted, and it's so much more common than we think. 1 in 7 people actually carry this virus, and for some of us, it just doesn't show up on the skin. The herpes virus stays dormant if your immune system is strong and you're not stressed. But if you're stressed, it can cause the virus to reactivate and then outbreaks to happen. So if you're experiencing the occasional cold sore, one of my tips to you is to use your diet as medicine. So food as medicine. There are 2 specific building blocks for proteins in foods, and many different building blocks for proteins, but 2 specific ones called arginine and lysine, and these can impact cold sores. If there is an imbalance in the ratio towards having more arginine and less lysine, this can cause for viruses to be more active. So try cutting down on foods that are high in arginine, and these include meats, grains, nuts and seeds, and this can help you with both preventing outbreaks, but also it can help your cold sores from heal faster. And if you have cold sores, know that this is really common and it's okay that it happens. Wrinkles and fine lines. So wrinkles and fine lines, these can be surprising and it can be distressing when you first see them. And in 2020, you might have felt like you've aged 20 whole years. These are the appearance of folds on the skin. They can be really fine, like around the eyes, and only showing up when you smile, and these are called the crow's feet. Or they can be deep and present without movement, like the lines between your eyebrows, and these are called your low-ins. Stress can cause wrinkles and fine lines in 2 ways. First, stress can decrease your skin's hydration levels. Stress can suppress your production of hyaluronic acid, which is your body's natural moisture reserve. Second, stress can cause the breakdown and slow the production of collagen and elastin in your skin, which are the proteins that give your skin bounce and elasticity. And the combination of these 2 are wrinkles and fine lines. To prevent lines from becoming deeper, one of my tips to you is to use both internal and external treatments. Internally, consider collagen supplements. There are quite a lot of studies to show that taking collagen can help to improve your skin health. Consuming collagen will give your body the building blocks that it needs to keep our skin strong. And you can get collagen through powders and supplements, or you could incorporate them into your diet through foods like bone broth, which is really naturally rich in collagen, and eating more fish, but make sure you eat the skin of the fish as well, which is the richest in collagen. Externally, when you're outside, make sure to put sunscreen everywhere. Now that it's summer, the sun is out, and it's even more important to protect your skin from UV damage. You may also want to consider a high-quality retinol that's right for your skin. Retinol can help with collagen production and also the production of new blood vessels in the skin so that it can not only improve your texture of the skin, but also your skin color as well. But retinol can break down really easily, so it's really important to have a high-quality product. Often I'm going to write prescriptive topical retinols for my patients because we know that it works. And if you're using a retinol, make sure that you introduce it really, really slowly into your routine to prevent all the side effects of this dry skin and the flaking. And know that it's going to take months for the results. It's not a quick fix. And not only use it on your face, but use it on your hands and your neck too. People say that they can tell your age by your neck. Sagging skin. So this is the appearance of skin that has lost its elasticity. We commonly find examples of this around your jawline, so jowls, or lines that extend from your nose to your mouth called your nasolabial folds. Underneath our skin, we have pads of fat that provide structure to our face. And stress can cause these pads to break down faster, leading for less support for the skin on top. And similar to how fine lines and wrinkles show up, stress can negatively impact our collagen and elastin production, making your skin more thin and then less capable of bouncing back. And that combination of the fat pads thinning and the skin thinning is sagging skin. So to prevent your skin from sagging, one of my tips to you is to sleep on your back. Sleeping on your face can really exaggerate the effect that stress already has on your skin by putting constant pressure on your already stressed out skin for an extended amount of time. And I know that sleeping on your back can be difficult for those of us that are stomach sleepers. So if you want to try sleeping on your back, my tip to you is to use a lot of pillows. One under your knees to support your back, one on either sides of you to keep you from rolling over, and one, of course, underneath your neck. And I personally find it's hard to sleep on my back sometimes. So I find that sleeping with these pillows can help with supporting your back. And I do find that when I wake up in the morning, if I haven't been smushing my face all night long, that I do find that there's a difference in my skin. If it's too difficult and you're like, I can't sleep on my back, consider using a gua sha stone to give yourself facial massages. So kind of like this one here. Use gentle upward motions. I like to start with the chin, and then make the gua sha stone flat on my face so it's not pulling too hard. And then for those of you who have jaw tension, putting it at the edge of your skin or your jaw here and wiggling it around can really help with the tension there. And if you incorporate this into your routine, it can help to put you into a state of rest and relax. Okay, hyperpigmentation. Hyperpigmentation is the darkening of skin in certain areas. It can affect your skin tone and it can cause it to look uneven. Hyperpigmentation can be caused by many things, and one of them is stress. Physiological and emotional stress can alter your body's melanin production, so your skin's pigment-producing cells. And in some cases, stress can actually activate a gene that promotes your skin pigment production. And stress can also impact your other hormones. So for example, the effect of stress in your body can show up in slowing down your estrogen detoxification processes. And excess estrogen can be one of the big causes of hyperpigmentation. So if you find that you have uneven skin tone and hyperpigmentation, one of my tips to you is to use antioxidants, whether it's in your skincare or through supplements or through food. Antioxidants can help counter the effect of stress on your skin. And one of my favorite antioxidant-rich foods are wild blueberries. These are berries that have gone through stress themselves, through environmental stress in the wild, so they're extra rich in antioxidants. Or invest in a good topical vitamin C serum. And make sure it's a good quality because similar to retinol, vitamin C can break down really easily. Use your vitamin C first thing in the morning so your skin is protected throughout the whole day. All right, so most people look in the mirror and they see dark under eye circles, they often think that they're not getting enough sleep. But stress can be the big underlying cause. How many of us have looked in the mirror over 2020 and then we look and we see dark under eye circles? Stress can be a big catalyst in creating a dark under eye for a number of reasons. So first, stress can dampen your absorption of nutrients, and it can also make your body use them up more quickly. And some of these deficiencies have been studied and are shown to be linked to dark under eye circles. So common ones include iron and B12 deficiencies. Secondly, stress can break down your fat pads and it can create a depression, which will cast a shadow underneath your eyes. So it can make the area look more hollow. And then third, stress will thin your skin so that you can actually see the blood vessels underneath. And that's why the area can look more sallow or purple, is because you can actually see your blood vessels. And then lastly, stress can impact your electrolyte balance and it can lead to fluid accumulation underneath your eyes, making it look puffy in a way that it would accentuate circles. So if you have dark circles, one of my tips to use is to use cold green tea bags as compresses over your eyes. You've probably seen this technique before, and it's true. Green tea contains tannins, and tannins can help to tighten skin. This can also be a really relaxing moment, so you can take a 10-minute time out, deep breathe, and not only will the deep breathing help to bring you into a state of rest and relax, where skin healing is prioritized, but the tea bags will also do some work while you rest. And my second tip to use is to make sure you keep hydrated, as dehydration can cause your under eye area to look even more deep. So you might as well take the time to hydrate as you have the tea bags on. And a lot of my patients always ask me, how much water should I drink each day? For my patients that don't have any kidney issues, I always recommend having at least 2 to 3 liters of water per day. One way to measure if you're hydrated properly enough is to check if your urine is clear. If it's not clear, and you can see your pee, then make sure you drink more water. I also find it personally helpful to have an app. There's a lot of great ones out there, or a reminder on your phone or your watch, because it's so easy to be preoccupied by your stressors. And then before you know it, the day has gone, and you haven't even drank a single drop of water. Drink water right now. And then after meeting your water intake for a couple weeks, see what happens to your dark under eye circles. Our 10th and our final skin condition is hair loss. Hair loss can greatly impact both men and women equally. One of the biggest signs of stress is hair loss. And not only does stress cause hair loss, but hair loss itself can also cause stress, and it can become this vicious cycle. Hair loss can be really alarming and can be really degrading on our confidence. There are many causes of hair loss, from genetic components, autoimmune conditions, thyroid issues, or other hormonal causes like post-pregnancy. Today, we're talking specifically about stress-induced hair loss. And there's actually a name for this. It's called telogen effluvium. And what happens here is that your hair gets forced to fall out more easily. And this is because your hair goes through different growth cycles. So 80 to 90% of your hair should be in the growing phase, and it's called anagen. And 10% is in the resting phase, and it's called telogen. Both stress can cause high cortisol, both high cortisol and inflammation. And the combination of these two will cause your hair to stay in the resting phase for longer, where it's not going to grow and it's more easily able to fall out. And on top of this, we know that stress can affect your diet, and it can also decrease your ability to absorb nutrients like minerals. And our hair needs nutrients like minerals, especially, to be able to grow, or else it's going to be falling out even more easily. So this combination of your hair being pushed into the phase where it's more likely to fall out, the decrease in nutrients to your hair follicles, stress can be a really big cause of hair loss. And if you have other underlying causes of hair loss, stress can make things even worse. So, for example, when we think about genetic hair loss, the most famous hormone involved is called DHT, so dihydrotestosterone. DHT can influence hair loss in a couple different ways. So first, DHT will shrink hair follicles, so we get smaller and finer hairs. DHT will also push your hair into the resting phase, much like stress-induced hair loss. And factors that can increase DHT in your body does include your family history, but it's also been shown to increase with stress-induced states like being overweight, not having optimal lipid levels, or cholesterol levels, and with poor blood sugar regulation, like insulin resistance, which we talked about when we talked about acne, all of which are really closely related with stress. So stress can cause hair loss in many different ways, from directly impacting the hair growth process, but also influencing our hormone balance with things like DHT, which can impact important factors like the size of your hair follicles. So if you're struggling with hair loss, one of my tips to you is to pay attention to the pressure that is placed on your hair follicles. Avoid really tight ponytails and hats, because this can pull too harshly on your hair, and it can cause your hair to fall out more prematurely. Instead, incorporate gentle scalp massages. And there's been studies to show that scalp massages can help encourage blood flow and hair growth. One really cool specific study in Korea looked at 15-minute scalp massages for police officers. And then they measured their cortisol levels, their adrenaline, and blood pressure, and it showed a significant decrease in the stress factors after scalp massages. And one other study I was looking at looked at the use of peppermint oil when mixed with jojoba oil, and showed that topical applications to the scalp can help to promote hair to stay in that growing phase. So if you're experiencing hair loss, consider incorporating relaxing scalp massages with a little bit of peppermint oil into your routine, and this may help with hair loss. And my final tip to you for hair loss is to incorporate Pure F treatments. Pure F is platelet-rich fibrin, which is becoming a really popular treatment as a treatment to help with hair growth. So stress can be the biggest underlying cause or trigger for your skin issues. And I wish I could wave a magic wand and all of your stress and your skin issues that came from this last year would just go away. But realistically, to find a solution, we need to identify how your stress is affecting your skin and create an action plan. And things can get even more complicated if we have other underlying reasons for our skin issues. And this is where a really thorough discussion of your health history and diagnostic testing can come in. So testing can really help to streamline the process towards effective treatment options. It's not always required, but it's really empowering to understand what's going on inside your body and how it might be impacting your skin. Some of the options can include basic blood testing to check for deficiencies like B12, iron, your vitamin D. A really popular test is food sensitivity testing, and especially if you're struggling with digestive issues or you have difficulty figuring out what's best for you to eat, this test can show you on a list of what is causing the most inflammation with a number scale so that you can remove these foods for a time frame and then use that opportunity to heal up your digestive tract and your skin, and then eventually with the goal of putting the foods back in. My personal favorite test here is urinary hormone testing. This test can lay out not only what your hormone levels are, but how your body is processing them. On this picture here on the bottom left, you can see that this is graphing out exactly what your cortisol curve would look like. This test would also show what your DHT levels are. So is it a component for your hair loss? DHT levels are really important here. Or if your androgen levels are really high and that's what's causing your acne. And it's also going to show us how you're processing your estrogens and if you need to have certain steps supported for detox support. Diagnostic testing can really pinpoint the steps that we need to take to expedite the process of getting you feeling better and looking good. And once we understand the root cause of your skin struggles, it's important to match your treatment options with your goals and your lifestyle. And sometimes the options available can be overwhelming. And with my patients, I understand that we want to tackle that root cause, but we also want to get immediate relief as well. So the great thing is there are a lot of options. And I would categorize these options in two ways: internal options and external options. So some of our internal options are a therapeutic nutrition and detoxification plan, addressing your deficiencies or using herbs to balance your hormones, or maybe we're using acupuncture to release muscle tension and to help you bring you into a balanced state. For your external options, that they can include treatments like PRF for the dark under eye circles or hair loss, microneedling, or Botox and fillers that match your natural aesthetics is definitely okay. And a lot of my patients that come in with skin struggles that are causing a lot of stress, it can cause a lot of grief. And sometimes it's about those immediate fixes while we deal with those underlying causes. So before we get to a detailed, customized treatment plan for you, here are a few foundational steps that you can take right away to help counter the effect of stress on your skin. So first is to prioritize deep sleep. Restorative sleep will help with regulating your cortisol levels, and it's the time that your skin needs to heal, and it's called beauty sleep for a reason. And second is to eat nutrient-dense foods and balanced meals. Make sure that you have fat, fiber, protein with every single meal, and eat naturally colorful foods that are high in antioxidants. And the third is to hydrate. It's so simple, but it's so easy to let this one slide. And fourth is to move your body. Incorporate a mix of cardiovascular, weight-bearing, and stretching type exercise, all of which will keep your body in balance and support your skin health. So these are the things that we can support our physical body when it comes to stress. But how do we support our minds and process our emotions during times of stress? And here are a couple tips. So the first is to incorporate mindfulness practice into your day. We can't always change our environment, but we can influence how we react to it. We can practice mindfulness through meditations or long walks, or maybe for you, it's just drinking your tea in the morning really slowly and making an intention for the day. And then second is to make time for play. And I think this is something that isn't emphasized enough. We all have a little kid within us that just wants to be let loose. So whether it's singing or dancing or whatever it is, make sure to incorporate some fun into your daily routine. And third is to get support. Sometimes it can be really difficult to put all these changes in when you're in the midst of stress. And this is where treatments come in. So for example, I really love offering acupuncture and IV therapy as a part of a treatment plan because it's passive and you can relax and let the treatment do its work. And with my patients, I understand that we all need some support to get to the point where we feel great and it's reflected on our skin. So we've learned that stress from 2020 has taken a much larger toll than we've anticipated, but and there's different ways that it can show up on our skin. But the good news is that there are very effective measures that we can take, both to tackle your current skin issues that you're dealing with, as well as to address the root cause at the same time. So this wraps up the talk portion of this talk. And I'd like to pass this on to Darcy, and we can open up the questions.
That's great, Dr. Wong. Thank you so much for that talk. Wow, it has been quite a year, hasn't it? And I, for one, feel very hopeful after hearing some of the steps you've outlined. So we're not alone, and there's lots of things we can do to really help ourselves. Let's take a quick look and see if we have some questions. Okay, we have two questions that are actually the same, but they're obviously quite important. So how do you test for PCOS?
Well, that's a good question. There's a lot of different tests. So I would divide that into blood testing and urine testing. So blood testing, you can check for a lot of hormones through blood, but a lot of our hormones are bound to different proteins, and it really depends on where in your cycle you are. So testing for hormones through urine is really great. Through blood testing, I like to test for your insulin and your glucose, and there's a calculation that I do based on those two numbers to show what your insulin resistance score. There's a lot of different tests that are available, but the technical diagnosis of PCOS is through symptoms. But I find that the root cause of PCOS often is insulin resistance, or there might be a different component. So blood testing can show, is it an insulin component? Is there an androgen component? Is there a thyroid component? Which part there is. So there's a lot of tests that are available.
Well, that's good to know. I really love too that you're so big about nutrition, because obviously that's where we live and breathe as well. You did mention collagen, and I know that collagen is a really popular supplement these days. Can you just give us a quick comment on whether you would recommend, say, a bovine collagen versus a marine collagen? Does it come down to personal preference, or do you have any thoughts on that?
Yeah, I think it's personal preference. I feel like there's a lot of people that are like, oh, a bovine source. They're like, oh, I don't know about that. Or I'll be like, okay, here's a marine source. I'm like, oh, ew. And I think that they do, I think they personally taste quite different. Like one has more of a fishy aftertaste, and one has more of another aftertaste. But personal preference, yeah. I think with how busy all our schedules are and everything that we're doing, I think it's whatever is most palatable and easy for the person to take. Yeah.
Thankfully, there's some flavorless ones, so let's hope they truly are flavors. I know they're all quite clean now, which is good. So, so hang on, we have one more question in here. Does staying on my mobile at bed make my eyes black or dark? So what kind of impact does screen time have on the health of our skin, and maybe specifically on under eye circles?
That's a good question. Well, I mean, directly from the screen going towards the eyes, I can't think of any specific mechanisms that would have the screen with the light affecting the dark under eyes. But I think it would be more from the indirect effects of the light exposure at a time where there shouldn't be light exposure. So that light is going to hit your retina and go into your brain, and your brain's going to be like, oh, it's morning time. I'm supposed to be awake so it can make more cortisol. And then your cortisol curve could be out of whack, and that's a big stress for the body. So yes, it can affect the dark under eye circles, but from a kind of an indirect way where the light affects cortisol. The cortisol affects the stress in your body, and the stress in the body then affects your collagen production and your blood vessels and all of that. So yes, it does affect the under eye circle in a complicated way.
Another good reason to really sleep when we get to bed, isn't it? Could you just comment once more just on the sleeping position? I know that you had said sleeping on your back is the best, but you're saying if you absolutely can't, did you say that you could go onto your side with some pillows, or maybe you could just reiterate that for us?
Oh, the thing that was the alternative would be to use guasha stones and like a massage to counter the effect of squashing your face overnight. Yes.
I understand that. I used to work with a woman that would never schedule business meetings before noon because her face was all squished. So it truly is a real thing. But okay, here's another question for us. What can help with redness and small bumps on the face, even if I eat fairly healthy and drink enough water?
Good question. I think it depends on what the root cause is for the bumps on the face. So whether the mechanism is with like if there's a say a an infectious base reason why there would be bumps on the face, or is it a purely an inflammatory reason, or what is that root cause of what's causing the bumps on the face? I think that it's really good that whoever asked the question is using good nutrition that can help support your skin and healing a bit better. But I think looking at what is actually the root cause of those bumps would be really important, because maybe it's not food that's the biggest reason, it's helping it, but maybe there is either an infectious component, a hormonal component, a blood sugar component. So looking at what that root cause would be, I think is really important.
That would be a better approach than maybe starting to use creams and things on our own, just in case there's an underlying medical condition.
Yeah.
And then what about the importance of wearing sunscreen every day to help us really not look any older than we need to?
Yeah. In terms of like, should we do it kind of thing? Yes,
Right. Yeah.
definitely.
Okay.
Yes, I think that our skin it can be really sensitive, especially if we're undergoing stress, because we know that when we have, for example, like antioxidant rich foods within us and like that we're eating and our body's doing well, it can actually counter the effect of the sun better. So we live in a stressful environment. We are all like going through a lot of pollution and all of that through the city if we live in the city. So making sure that we're protecting our skin is really important.
That's a good point. Another question just popped up. When you're detoxing through a cleanse and your skin gets red bumps as a result of the detox, what do you suggest to put on the skin?
Oh, to put on the skin. I think there's lots of things internally to do. Depends on what kind of detox is happening. I think to put on the skin, it depends on where the bumps would be. I always love neem cream. I think that most people can tolerate neem cream really well. Actually, I got my neem oil from Choices.
Nice.
So neem is really, it's an emollient, it's antimicrobial. It smells kind of funky, so some people don't like the smell of it, but it's not expensive. So I quite like neem cream and neem oil. I think making sure that your liver is supported, because when it comes to those detox effects, it's not just that it's all coming out, but it's also there's different phases of liver detox. So like phase 1, phase 2, but there's those immediate toxins that can be there. So if the detox process is not proper and it's not actually going out of your system, then the detox effects can be there a lot longer. So making sure that each step of, say, your liver process is supported.
That's a good point.
Mhm.
Okay. So we'll just give another second here. Any more questions from our participants tonight? Well, that was great. Well, Dr. K, thank you so much. We really appreciate the time you've taken to make us feel so much more hopeful about our skin. So I'll be putting the website for Dr. K's clinic as well in the chat. And if you have any further questions, you can email the staff, and that's also written down in the chat. So on behalf of Choices Markets, thank you very much, Dr. K, and thank you all for participating. And we would we have one final question we'll take. How about eye bed? Any suggestion? I'm not sure what eye bed means. Eye bed. Maybe something with your eye when you sleep. Sorry, I'm not quite sure what that one means. But you could always email that question directly through to the clinic to get more information. Anyway, so again, thank you all so much for coming. And when you receive your survey link tonight, please fill out your address. We'll be mailing you our complimentary coupon. And we hope to see you again at another Choices seminar soon. Okay, so thanks very much again.